Hi everyone, welcome to my channel. Today I am going to deal with the subject that is nursing foundation. So topic in this is, today we are going to the topic obstetrics and gynecological instruments used in nursing. So first here is the name of the instrument, that is, and here it is the uses of it. So first instrument used in the gynecological and obstetrical nursing is the uterine sound. What is the use of it? It is used to measure the length and depth of the uterine cavity. So next, the name of the instrument is the ovum forceps. As the name indicates, ovum forceps, it is a forceps which is used to remove the ovum products or the placental fragments and products of conception. And also it is used as hemostatic clamp. What is the meaning of this hemostatic clamp? It is nothing but the instrument to control bleeding by clamping the blood vessels. This is the forceps which we used to control the bleeding by clamping. That is, by clamping the blood vessels of this, the bleeding can be controlled. So it is used for the two uses of the ovum forceps. First is to remove the placental fragments and products of conception, that is at the time of abortion, and also used as hemostatic clamp. Next is the uterine curette. The use of this uterine curette is to scrap the endometrial cavity or uterine cavity to obtain samples. Next is Sims vaginal speculum. It is a double-bladed speculum used to examine vagina and cervix. It is used to examine the vagina and the cervix. Sims anterior vaginal wall retractor. It is for the use for easy visualization of cervix and vagina. Next is Aries spatula. These are the wooden spatulas which is used to collect pap smear. That is for the Papaniculaou test. Pap smear is done. This is a procedure which is done to detect the cancerous lesions in the cervix. To detect the cancerous lesions. And then the broad end is for vaginal sample collection and the narrow end is for the cervical sample collection. The wooden spatula has the broad end and the narrow end. The broad end used for the vaginal sample collection and the narrow end is used for the cervical sample collection. So this is episiotomy scissors. As the name indicates, these are the scissors which are used for the episiotomy, that is cut or the tear of the that is cervix, that is to at the time of during the second stage of labor, when the baby is difficult to come out of the cervix at the time of or the baby's head is big at the time of what happens, the main last option will be to cut the cervix. So that the scissor used for that to cut the cervix is nothing but the episiotomy. So this is episiotomy is used during the second stage of labor. This scissor to cut the cervix. So next instruments is the IUCD, removing IUCD nothing but intrauterine contraceptive device. What is this instrument used for? It is used to remove the intrauterine contraceptive device. Okay. Next is the metal venous cup. What is the use of it? It is used to assist the vacuum deliveries. Next is copper T. That is there are two types, 380A and 375. So 380A, it is a copper T, nothing but it is a type of intrauterine contraceptive device. So 380A it is used for 10 years and 375 it is used for 5 years. It means that once it is been inserted into the uterine cavity, it can stay for up to 10 years at 380A and 375 for up to 5 years. So it is why it is used. It is used for the birth control device as for birth control and spacing. Spacing nothing but after one child, to at least minimum of 2 to 3 years of gap to be present. So for that spacing period, it is used as one of the family planning method. Umbilical cord clamp. As the name indicates, this is the clamp which is used to cord. It is an instrument which is used to clamp the umbilical cord. It is used to clamp the umbilical cord following the delivery. Umbilical cord cutting scissor, instrument used to cut the umbilical cord. Next is Higa's dilator. There also it is used for to treat vaginismus. What is vaginismus? It is nothing but the tightening of vaginal muscle. So when there is a tightening of a vaginal muscle, when the dilator is been inserted, dilator comes in the various sizes. So when it is inserted, it helps in loosening of the vaginal muscles, and also it is used for cervical dilatation, that is cervix dilatation, and it also used to increase the size of stoma following colostomy. Next is the uterine dressing forceps. It is used for packing uterine cavity and it is used to remove the tissues and IUD intrauterine retrieval during gynecological procedures. So next is the Ferguson's vaginal speculum. It is also a tubular in shape. So the uses of it is a tubular speculum used to diagnose vaginal and cervical conditions. Next is Simpson perforator. It is used to remove fetus or to perforate fetus skull in an arrested labor where mother's life is at risk. Next is amniotic perforator. As the name indicates, amniotic, that is amniotic fluid, it is used to rupture the amniotic membrane. Craniotomy forceps, that is, it is also known as cranioclast. They are used for breaking up the skull of the fetus, and also when the fetus died in the womb, last resource in difficult labor. When the fetus is dead in the womb, and the last resource time it is the difficult labor, it is we use the craniotomy forceps. That is, next is the breech hook. Breech is nothing but the breech delivery. Head or trunk of the unborn fetus is extracted by inserting blunt hook around neck or shoulder. That is Wrigley outlet forceps. That is, delivery head of baby is at +3 station and used at terms of fetal distress or maternal issues. So next is the Doyle's myoma screw. It is used to remove the fibroids from endometrium during myomectomy. So next is the Willett scalp traction forceps. It is a forceps which is used to ease the delivery of a newborn by grasping its scalp with the smooth flattened blades. So that is Cludotomy scissors. Next, in case of dead fetus with shoulder dystocia, for bulk reduction of one or both clavicles are divided using these instruments. So next is the Richardson retractor. It is used during the appendectomy surgery, cesarean section and laparotomy to hold and retract back muscles. Thank you. Please do like and subscribe to my YouTube channel. And if you have any doubts, please do comment in the comment box related to the topics. And please follow me on the Facebook and Instagram.